Hello everyone and welcome to another session of Next Saviours Essential Question Series. Today we are going to have a discussion on the differential diagnosis of the vocal cord lesion, particularly the nodule, the vocal cord polyp, the Riehnke edema and papillomatosis. You see, when you see these kind of the questions, then it sounds overlapping. There is a possibility that despite knowing the correct answer, we can mark the answers wrong because we tend to get confused. So let's see how these questions are asked and what are the specific findings related to the each topic. The question number one is 32-year-old female school teacher. Now, this is the occupational history which is provided to you. It could be a singer or it could be a school teacher which could be provided. That means it is suggestive of the chronic abuse to the vocal cord. Presents to the OPT with a 3-month history of progressive hoarseness of voice. Now, this is the second clue which is suggestive of the chronicity of the disease. Now, she reports that her voice becomes worse by the end of the day and improves with rest. She denies any pain, dysphagia, or hemoptysis. She has no history of recent upper respiratory tract infection, smoking, or alcohol use. On further questioning, she mentions that she often has to raise her voice in a class and speak continuously throughout the day, which is again suggestive of the chronic abuse that the vocal cords are subjected to. So on indirect laryngoscopy, the following finding is seen. And if we see what is there on the indirect laryngoscopy as the findings, that there is a presence of bilateral lesions which are appearing in the form of small symmetric swellings. If we look at the specific location of these lesions, then they are present at the junction of the anterior one-third and posterior two-third of the vocal cord. And this is the classical site where the maximum vibratory trauma happens. Now, looking at the characteristic finding of these lesions, then these lesions are appearing smoother, appearing firm, which is obviously suggestive of the chronic benign lesion like a nodule, not vascular like polyps or papillomatosis. And there is no evidence of the ulcerations or the papillomatous changes or mass invasions. So these are the specific findings for this particular type of the question, which will talk about related to the diagnosis once we will be comparing all these types of the vocal cord lesions. So this is one such category where there is a chronic abuse to the vocal cords in the form of a professional use which could be provided to you in the question with specific features appearing on indirect laryngoscopy on the vocal cords. Now, coming on to the next question, a 40-year-old male presents with a persistent hoarseness of voice for the last 2 months. He reports that his symptoms started after the episode of shouting during the sport event and has not resolved since then. Now, there is obviously a difference as far as this clinical feature is concerned compared to the previous type of the scenario where it was a chronic condition. Here it is the acute condition. Now, he denies any throat pain, fever, or difficulty in breathing, but he has a history of smoking 10 cigarettes per day for the last 15 years. That means one of the risk factor which is present over here is smoking. Now, there is no history of voice overuse in his profession. He also is complaining of sensation or something is getting stuck in his throat, which is considered to be a specific clinical finding related to these specific lesions. On indirect laryngoscopy, what are the findings that we are getting is that the lesion is unilateral. Now, in comparison to the previous one, here the lesion is present only on the one local cord. Second, that it is again smooth like the previous one, but it is translucent. Now, if compared to the lesion A, it was not translucent. Here, the lesion is translucent and it is appearing reddish in appearance. This reddish, translucent, or smooth appearance is characteristic of a pedunculated or a sessile polyp. Now, if you look at the location where it was specifically located on the previous slide, it was specifically located at the junction of anterior one-third and the posterior two-third. Here, it is located in the mid-membranous portion of the vocal cord and there is no symmetry. Rest of the laryngeal structures, they appear absolutely normal. Now, if we compare these two types of the vocal lesions, then obviously there is a difference. The first difference that we have encountered was the chronic use. Here in the scenario 2, it is the acute event. In the scenario 1, there was no relation with the smoking or alcohol, but here as a risk factor, smoking is present. 3, if you look at the specific lesions, then there is a bilaterally symmetrical lesion which is present at the junction of the anterior one-third and posterior two-third, but here it is a smooth reddish translucent mass which is present unilaterally on one vocal cord. So obviously these two are two different lesions. Coming on to the third lesion, which is very, very commonly kept in your examination, is that a 52-year-old woman presenting to the OPD with the complaint of progressive hoarseness of voice for the last 1 year. Again, the history is insignificant. Now, she describes her voice as husky and low pitched, again, not making much of a difference. Now, she's a chronic smoker and works as a receptionist. Now, again, one of the risk factors which is provided to you is that of a chronic smoking. Now, there is no history of pain, hemoptysis, or dysphagia. She also reports of her symptoms, which improve slightly with the voice rest but recur afterwards. When you see on indirect laryngoscopy, following are the findings. Now, if you look at the clinical history, then apart from smoking, nothing significant which is provided to you in the clinical history. But when you look at the specific findings of this lesion, then this lesion is obviously bilateral and symmetrical swelling of the vocal cords, the entire vocal cord swelling. Now, here the cord obviously is appearing pale, it is appearing translucent, but at the same time, it appears balloon with a gelatinous appearance. And the swelling is localized to the superficial layer of the lamina propria, which is also known by the name of the Riencase space, leading to a specific sort of the shape known by the name of sausage shaped or floppy cords. And these specific findings are exactly different from the previous two categories that we have seen in the form of the vocal cord lesion. Now, this was, for example, if this is the vocal cord lesion 1, this is the vocal cord lesion 2, then vocal cord lesion 3 is entirely different in its appearance. We will obviously come to the conclusion that what are the names based on the clinical features and the indirect laryngoscopy findings. And finally, if we look at this question, then the question is altogether different. A 4-year-old, that means in case of a child, is brought to the OPD due to progressive change in the voice, which is noted over past 6 months. Now, his voice has become hoarse and weak and sometimes struggles to speak in full sentences. Parents, they deny any history of the foreign body injection, acute illness. He has no stridor at rest, but mild stridor appears during exertion. Now, flexible laryngoscopy reveals multiple wart-like exophytic lesion on the two vocal cords and surrounding laryngeal mucosa. There is no evidence of malignancy. The child was delivered by a normal vaginal delivery and mother had a history of condyloma acuminata during pregnancy. Based on the clinical scenario and endoscopic finding, which of the following is the most likely diagnosis? Now, there are several specific findings that you should be focusing on. First of all, the age which is provided to you over here, which is just 4 years, because you see this papillomatosis of the respiratory tract is common in juvenile age group. Point number two, if you look at the onset, then this onset is again gradual because the chronic hoarseness is provided to you in the question and it is a progressive airway lesion, as you already know. Now, most importantly, there is a history where the child was delivered by a normal vaginal delivery and the mother had a history of condyloma acuminata during pregnancy. So it is suggestive of the vertical transmission of HPV 6 and 11 with which it is found to be associated. So whenever you get these kind of the findings in the question itself, then the answer for that question obviously is not what we have seen in the previous three images. So answer for that question obviously is laryngeal papillomatosis. And how it appears on imaging, you see there is a presence of multiple exophytic grape-like lesions which could obviously be sessile or pedunculated. Another finding is that the lesions are arising from the true vocal cord and possibly extending to the other part of the larynx. So origin is from the true vocal cords. And point number three, the surface of these lesions, it appears ferruginous or irregular, which is obviously typical of the papillomatous growths. So these are the four images that we have talked about. Now, if we look at the specific findings for each of the condition that we have talked, like for vocal nodules, these are usually bilateral. There is a chronic etiology of the voice abuse, which is seen in teachers and singers, and it is specifically presented at the junction of the anterior one-third and posterior two-third. If you look at the first slide that we have talked about, then everything is present in this question. Then answer for that question number one obviously is the vocal cord nodule. Now, if you look at another feature for the vocal polyps, then they usually are unilateral. There is a etiology of acute vocal trauma and they may appear anywhere on the vocal cord, not specifically at the juncture of anterior two-third and the posterior one-third. And in the appearances, they appear pedunculated or sessile, translucent reddish mass. So if we go back to this question, then everything it is suggestive of the vocal cord polyp, and this is how the cord polyps are identified and differentiated from the vocal cord nodule. Then coming on to the third differential diagnosis is Reinke edema, which is often bilateral. There is an additional history of smoking or hypothyroidism which could be provided in the form of the etiology. The entire vocal cord is found to be affected and it appears pale, floppy, and gelatinous cords. Now, if you look at this image and if you look at this question, then just by looking at the image itself, you can identify that the answer for this question is Reinke edema. And then finally, typical history of HPV transmission with multiple grape-like papillomas arising from the two vocal cords having diffuse laryngeal spread, which appears warty with multiple masses, leading to progressive hoarseness of voice or even sometimes airway symptoms in the form of stridor, then answer for that question is papillomatosis. So I hope you would be able to differentiate in between the vocal nodules, vocal polyps, and Reinke edema along with papillomatosis based on the clinical features and the appearances on the indirect laryngoscopy. Hope you have learned something new. All the best for your future examinations. In order not to miss any update, please join our Telegram group. The link is provided to you in the description. Thank you.